Reproductive life planning includes all the decisions an individual or couple make about whether and when to have a children, how many to have, and how they are spaced. A number of 2020 national health goals speak directly to reproductive life planning are: increase the proportion of adolescents who receive formal instruction on abstinence before 18 years of age from a baseline of 87.2% to a target of 95.9%. Increase the proportion of adolescents who receive formal instruction on abstinence before 18 years of age from a baseline of 87.2% to a target of 95%. Reduce the proportion of females experiencing pregnancy despite use of a reversible contraceptive method from a baseline of 12.4% to a target of 9.9%. Lastly, increase the proportion of intended pregnancies from a baseline of 51% to a target of 56%. Next slide, we have a number of 2020 national health goals speak directly to reproductive life planning. Decrease the proportion of births occurring within 18 months of a previous birth from a baseline of 35.3% to a target of 31.7% according to U.S. Department of Health and Human Services (DHHS). On the other hand, nurses can help the nation achieve these objectives by teaching people, especially adolescents, about contraceptive options while being cautious to avoid directly encouraging sexual activity among teens.
Contraception is by using of drugs, devices of surgery to prevent pregnancy. As many as 93% of women of childbearing age in the United States use some form of contraception. Major benefits of this is increase in contraception include decreases in unattended adolescents' pregnancies, they need for morning and after, or postcoital medication, and elective terminations of pregnancy.
Why should we use contraceptive? By reducing rates of unintended pregnancies, contraception also reduces the need for unsafe abortion and reduces HIV transmissions from mothers to newborns. This can also benefit the education of girls and create opportunities for women to participate more fully in society, including paid employment.
Important things to consider when helping a couple choose a method that will be right for them include personal values, ability to use a method correctly, if the method will affect sexual enjoyment, financial factors, if a couple's relationship is short-term or long-term, prior experiences with contraception, future plans.
People differ greatly in the way they desire or accept information on reproductive life planning, depending on individual preferences and socio-cultural influences. For example, certain religions do not believe a method beyond abstinence or fertility awareness is right to use. People with lower incomes cannot afford surgical procedures or methods such as daily combination pills. Be certain while counseling in this area that you do not impose your own values on people, but rather, work together to identify a system that your patient will be able to follow consistently.
Ideal contraceptive should be safe, effective, compatible with religious and cultural beliefs and personal preferences of both the user and sexual partner, free of bothersome side effects, convenient to use and easily obtainable, affordable and needing few instructions to effective use, free of effects after discontinuation on future pregnancies. Before a patient begins a new method of contraception, information that should be obtained include vital sign, obstetric history, including STI, subjective assessment of the client's desire, needs or feelings, and sexual practices such as frequency, number of partners, feeling about sex, and body image.
Family planning. Family planning methods, also called periodic abstinence methods, are, as the name implies, methods that involve no introduction of chemical foreign material into the body. Abstinence. Abstinence, or refraining from sexual relationship, has a theoretical 0% failure rate and is also the most effective way to prevent STIs. Clients, however, particularly adolescents, may find it difficult to adhere to abstinence because of peer pressure. In a moment of passion, many otherwise responsible people may completely overlook abstinence as an option. Because it is difficult for many women to adhere to abstinence, the method has a failure rate as high as 85%. Lactation amenorrhea method. As long as a woman is breastfeeding, there is both natural suppression of ovulation and return of menses. Lactation amenorrhea method is a safe birth control method. If an infant is under 6 months of age, being totally breastfed at least every 4 hours during the day and every 6 hours at night, receives no supplementary feedings, and menses has not returned.
Amenorrhea.
Amenorrhea is the absence of menstruation, often defined as missing one or more menstrual periods. Primary amenorrhea refers to the absence of menstruation in someone who has not had a period by age 15. Absence of menses is normal to pregnant woman, breastfeeding, and menopausal woman but pathological otherwise. Amenorrhea is not a disease on its own, but rather a symptom of a variety of underlying conditions. Primary, periods have not yet started at the age of 14 to 15. Secondary, had periods before but have stopped.
Monthly events that occur within a woman's body in preparation for the possibility of pregnancy. Each month, an egg is released from an ovary in a process called ovulation. At the same time, the lining of the uterus thickens, ready for pregnancy. If fertilization does not take place, the lining of the uterus is shed in menstrual bleeding and the cycle starts over. The menstrual cycle is under control of multiple hormones secreted by the hypothalamus, pituitary gland, and ovaries. Basically, the hypothalamus produces gonadotropin-releasing hormone, GnRH. The anterior pituitary secretes follicle-stimulating hormone, FSH, and luteinizing hormone, LH, while the ovaries produce estrogen and progesterone. These hormones are involved in a regulatory network that results in monthly cyclic changes responsible for follicular maturation and ovulation. Amenorrhea can be caused by anatomical or endocrine problems. Anatomical causes refer to abnormalities in the female reproductive system and include absence or underdeveloped female organs in some genetic disorders, such as MRKH syndrome, congenital defects that obstruct blood outflow, and destruction of the uterine cavity by previous infections or surgeries. Endocrine problems refer to structural or functional defects of the hypothalamus, pituitary gland, and ovaries. A common cause in this category is the impaired function of the hypothalamus, which occurs when the hypothalamic pituitary ovarian axis is suppressed due to an energy deficit. This can result from weight loss, eating disorders, excessive exercise, malabsorption syndromes, or emotional stress. The common feature is a reduced production of GnRH by the hypothalamus, which results in corresponding low levels of FSH and LH and subsequent impairment of follicular maturation and absence of ovulation. Other endocrine causes include Kalman syndrome, a genetic disorder associated with congenital defects of the hypothalamus causing GnRH deficiency. Sheehan syndrome, a condition in which excessive blood loss during childbirth or chronic hypotension during pregnancy impairs pituitary functions. Tumors, infections, trauma, or autoimmune destruction of the pituitary gland. Polycystic ovary syndrome, an endocrine disorder in which FSH deficiency disrupts follicle maturation. Loss of normal ovarian function in conditions such as Turner syndrome. Thyroid disorders. Treatment is by addressing the underlying cause and can range from nutrition plans, hormonal therapy, to surgical.
Coitus interruptus. Coitus interruptus or withdrawal is one of the oldest known methods of contraception. The couple proceed with coitus until the moment of ejaculation. Then the man withdraws and spermatozoa are emitted outside the vagina.
Withdrawal is when you pull the penis out of the vagina before ejaculating. That's why it's also called pulling out. Withdrawal keeps sperm out of the vagina so it can't swim to an egg and cause pregnancy. It can be hard to pull out correctly, so it's less effective than other types of birth control. You have to pull your penis completely out of your partner's vagina before any semen comes out, or pregnancy can happen. This takes lots of experience, so you've got to know your body super well and be willing and able to pull out in time, usually right when sex feels the best. Pulling out doesn't prevent the spread of STDs, but using condoms can help protect you and your partners. Withdrawal is free and always available, but there are many more effective birth control methods out there. Your nearest Planned Parenthood Health Center can help you find the best birth control for you.
Postcoital douching.
Douching following intercourse, no matter what solution is used, is ineffective as a contraceptive measure as sperm may be present in cervical mucus as quickly as 90 seconds after ejaculation, long before douching could be accomplished.
Fertile awareness methods rely on detecting when a woman will be capable of impregnation or fertile, so she can use periods of abstinence during that time.
Fertility awareness methods are sometimes known as natural family planning. This option doesn't involve taking or using anything. Instead, it relies on working out when a woman is in the most fertile phase of her monthly cycle and avoiding unprotected sex during this time. For this to be effective, it needs to be thoroughly understood and taught by a professional. But remember, it doesn't protect you from STIs, so make sure you use a condom too.
Calendar or rhythm method. The calendar method requires a couple to abstain from coitus on the days of a menstrual cycle, when the woman is most likely to conceive. To plan for this, the woman keeps a diary of about 6 menstrual cycles. To calculate safe days of these substances, 18 from the shortest cycle to documented. This number predicts her first fertile day.
Creating an ovulation calendar is pretty simple. The way to do this is to just get any calendar you might have, and what you'll do with that is you'll note on the calendar the days of your menstrual period, and you want to start with the first day of your menstrual period. So on whichever day that occurs, you write down number 1, and what you can do is just continue forward writing on every subsequent day number 2, number 3, 4, so on and so forth. And then when you have your next period, that again will start the whole process over again, and you'll start with number 1 on that day. By doing this, you'll know what the length of your entire menstrual cycle is, and a normal cycle ranges between 25 and 35 days. If your cycle is either less or greater than that, there's something causing that, and you should probably seek out the help of a physician to help figure that out. But if your cycle is within 25 and 35 days, as most are, then usually the most common reason for creating an ovulation cycle is trying to achieve pregnancy. So the next thing you want to figure out is when you ovulate. Ovulation is the optimal time to become pregnant. That usually happens anywhere between 13 and 15 days before the onset of your period. So what you do is you create a calendar of writing down when you have your periods, and then you do that for several months, and then when you see a clear pattern, then you can then extrapolate from that and go forward and optimize the times when you would engage in intercourse to try to achieve pregnancy.
Basal body temperature method. Just before the day of ovulation, a woman's basal body temperature, BBT, or the temperature of her body at rest, falls about 0.5 Fahrenheit at the time of ovulation. Her BBT rises a full Fahrenheit degree, 0.2 degrees Celsius, because of the rise in progesterone with ovulation. These patterns serve as the basis for the BBT method of contraception. To use this method, The woman takes her temperature either orally or with a tympanic thermometer each morning immediately after waking before she rises from bed or undertakes any activity. This is her BBT. A woman who works nights should take her temperature after awakening from her longer sleep period, no matter what the time of day.
Here's what you need to do to accurately chart your BBT. First, if you don't already have a basal body temperature thermometer, you can get one at your local pharmacy or drugstore, or even order it online. The package will say basal or fertility thermometer. Once you have your BBT thermometer, there are a few simple guidelines to follow to get an accurate BBT chart. The closer you get to these ideals, the more reliable your chart will be. Number 1. Take your temperature when you first wake up. It should be the first thing you do when you open your eyes, and stay resting while you take it. Number 2. Take your temperature at the same time each morning, or as close to it as you possibly can. You can set an alarm in the Fertility Friend app if needed. Fertility Friend automatically records the time you enter your temperature. It's important to note the time your temperature was taken. 3. Try to take your temperature after a solid block of sleep. Choose a regular time when you're likely to have been sleeping for a few hours. Finally, take your temperature the same way every day. Most women prefer to take it orally, but vaginally is also okay. Just be consistent. Those are the basics to get a reliable BBT measurement. If you miss a day or two, or you don't have ideal conditions from time to time, Fertility Friend can usually still interpret your pattern, but it's best to follow the guidelines as close as you can for the most accuracy. We recommend that you enter your BBT in your Fertility Friend app as soon as you take it. With this data, Fertility Friend can pinpoint your ovulation date, evaluate your conception chances, and provide a reasonable date to test for pregnancy, along with other insights about your cycle.